Hi everyone. Discussing about the pediatric hyperoxia test and its interpretation, and please listen carefully so that you will be differentiate in your net how to rule out respiratory disease and cardiac disease, and it is very important. So hyperoxia test and its interpretation we will discuss in this slide. And also the disorder between the respiratory and cardiac we will also review after this. And as I have already discussed in the previous video, so please listen carefully. Hyperoxia test and interpretation. The test itself given hyperoxia means we have to supply oxygen and see the oxygen saturation of the neonate in the ABG. And initially we have to obtain the right radial preductal arterial blood gas. Initially, first of all, step 1. In step 1 we have to obtain the right radial blood gas, preductal arterial blood gas, arterial blood gas while breathing the neonate in room air, while breathing in room air. Again we have to repeat the test. After that we have to repeat the test. Repeat the test after giving 100% oxygen 5 to 10 minutes via any method, via oxygen wood box or CPAP or in ventilator based on the respiratory support, or in ventilator based on the respiratory support. So after giving oxygen 100%, 5 to 10 minutes using oxygen wood or CPAP or ventilator based on respiratory support, and again we have to after 10 to 15 again we have to do ABG and interpret what is the value of partial pressure of oxygen. After 10 minutes, after 10 to 15 minutes, if we do again ABG of neonate, ABG in neonate, and we have to see the partial pressure of oxygen, and interpretation will be the clues to rule out the cardiac disease and respiratory disease. And if the partial pressure of oxygen is more than 150 mmHg, then the test is passed. We have to say the test is passed. If the partial pressure of oxygen is more than 150, the test is passed and exclude fixed intercardiac right to left shunt lesion, and it say that the cause is likely primary pulmonary disease. Cause is primary pulmonary disease, and it rule out the fixed intracardiac right to left shunt, and it excludes the cardiac disease. It excludes the fixed intracardiac right to left shunt lesion. And if the partial pressure of oxygen is less than 100 mmHg, test is failed. Test is failed means there is possible critical structural cyanotic heart disease, and like doctors dependent cyanotic congenital heart disease. It means doctors dependent cyanotic congenital heart disease. Doctors dependent doctors dependent, and in this case we have to initiate the prostaglandin infusion as soon as possible. Initiate prostaglandin infusion with urgent echocardiography. Urgent echocardiography, and also we have to do chest X-ray and USG of lungs to rule out other causes may be present. And if the partial pressure of oxygen is 100 to 150, then also test is failed. And it includes possible cardiac disease with good mixing. Cardiac disease with good mixing and increase pulmonary blood flow like TAPBC. Okay, this is the interpretation of hyperoxia test, and please revise it. So thank you, and we will discuss next chapter in next coming video. Okay, thank you so much.